Good afternoon, everybody. This is Dr. Gavin Dry here with the Phoenix. I appreciate you spending some time here in your quarantine, and this has been a very strange time for everybody, but I hope everybody is staying healthy, staying safe, staying at home. And I do want to take just a little moment just as a shout out to everybody who has been at work in whatever job they have in their essential capacity to keep us going during these difficult times. It's been a very difficult and strenuous time for a lot of individuals, and I certainly appreciate everything that everybody's been doing. And by the same token, for those people who are at work, but also a thank you for everybody staying at home. If everybody's staying at home, it allows us to be able to continue on to try to get back to the best of our abilities and to do the things that we want to do in life and to get back to normal activities. So persevere, keep going, and as I say with most things in life, you know, things won't necessarily work out sometimes the way that we think they should or the way that we want them to, but it's going to be okay in the end. And I truly believe everything is going to be fine in the end. So, plan for this afternoon. Basically, we're just going to take some questions. Any questions that come on your mind about anything. We've got some questions already lined up from questions that people have already sent in. But please, feel free to send out any questions that you want. I have my lovely wife on the end of the phone here who's doing the videoing and also going to be fielding the questions. So by any means, just shout out any questions that you have about anything in particular that you may want to know.
All right, so we first have some questions here about breast surgery. The first one we have is, do breast implants need to be replaced over time?
A good question. The short answer, no, is the short answer. You only really need to change an implant if there's a problem. If you don't have a problem with the implant, don't change it. And it's the same thing, dishwasher, car, anything like that. No problems, don't necessarily need to change it.
Okay. Another question is, will my implants start to sag over time?
Again, a good question, but the answer to that, no. Implants in and of themselves will not sag. The breast tissue, however, yeah, gravity still works. I mean, we do a procedure, we do a lift, a reduction, put in an implant, but gravity and aging still work, so the breast still will sag over time. The implants will generally stay in place, especially if you put them underneath the muscle because the muscle holds them in place. But again, the breast tissue will fall over top of that, not necessarily the implants.
Okay. The next question we have is, can I choose not to have implants if I want a breast lift?
Yes, absolutely. And again, whether or not you want an implant is dependent upon a number of things. I mean, it's dependent upon the size of the breast that you want on the end of it and necessarily the shape. There are a lot of people who have enough breast volume who basically, unfortunately, aging and gravity has taken place and they've gone down a little south and you need to put them back up again. And if you reposition the breast tissue, reposition the nipple and areola back to where it is and then tighten up the skin, then you don't necessarily need an implant. You'll need an implant primarily if you want to be bigger than what you started out with, or if you want to get a lot of volume in the upper portion of the chest here, because simply lifting up the breast doesn't necessarily give you that volume. But certainly if you want to be bigger or have more volume in the upper pole, then certainly putting in an implant is going to be beneficial. Okay,
to follow that up, will I lose a cup size if I have a lift without implants?
You'll lose some. Yes, I mean, as depending upon sort of the amount of lifting that needs to be done, you will go down in size. No, it's as a general rule, if you do a lift without necessarily a reduction in and of itself, you're going to go down by about half a cup size.
Okay. We also have some questions about tummy tucks here. The first one is it best to wait until you've had kids to do a tummy tuck?
Yes and no. And I mean, it depends upon sort of how soon you're planning on having children. I mean, if the children are going to be, the thought is going to be a year from now, 6 months from now, then yes, it's best to wait. But if it's like many individuals where you don't know, it's maybe going to be 2-3 years down the road, then, you know, you can certainly entertain undergoing a tummy tuck procedure at the present time with the notion that you may need to have it touched up later down the road. But it really sort of depends upon when you're anticipating and when you're thinking of having children and getting pregnant.
Okay. If you plan on having more children, is it recommended to wait to have a tummy tuck? That kind of falls in line with what you discussed.
Right, it's the same sort of thing. I mean, I think there's a lot of individuals who obviously have children, and that's why they want a tummy tuck to begin with. They have stretched out skin, stretched out muscles, And then if they're planning on having more children, again, it's just a timing thing. When are you planning and when do you necessarily want to have another child?
Okay, I'm next going to take a few of the live questions
All
before
right.
we go on to some of the ones that people have submitted. We have Cambria asking, how would surgery affect our immune system? Would we become more susceptible to viral infections after surgery? What are your thoughts?
Ooh, yeah, good question. And especially given sort of the current situation that we're in right now with the coronavirus and COVID. I mean, as a general rule, and this is again very general, if you undergo a surgical procedure, your immunity will be a little bit lowered. And it depends upon the magnitude of that surgery. So the bigger the surgery, the bigger the recovery, the more impact you potentially could have on your immune system. And that's general, with or without coronavirus and the lovely COVID that's going around. In the current situation right now, we do not believe that the magnitude of the surgery will impact the severity of coronavirus if you get it. If you have surgery of any sort and you did get coronavirus, you may have a worse recovery, worse illness with the coronavirus. But the magnitude of the surgery, the present data, and again, things are changing on a constant basis, but the present data suggests that the magnitude of the surgery now will not impact the severity of the coronavirus or COVID if you do get it. But of course, we're taking immense precautions against COVID and coronavirus. I mean, we are protecting both every single patient that walks into the office and every single staff member in order to make sure that we can do our best in order to be able to prevent it. We're taking extreme measures from an infection risk perspective in the operating room, in the ORs, in the patient rooms, in the receptions, every single one of our facilities to make sure that we can lessen that risk as best as we possibly can.
Great. Another question we have coming in from Henna K22. Am I able to stay awake during microbody contouring?
Good question. Depends upon how much. In essence, I mean, when we do the microbody contouring, there's a lot of individuals who we do it under what we call sedation, which is kind of a twilight sleep, where we give you some medication through your veins. And yes, in general, you can be generally awake. And it depends, again, on the magnitude of what you're trying to contour. If it's small 1-2 areas, then that's possible, absolutely.
Okay. We have a question from Kaman Maylene. Hi, Dr. Dry. I have lipo and a BBL scheduled with you. What safety measure do you practice when injecting fat into the butt?
Wow, smart questions. In essence, I mean, the big one is we only inject fat into the subcutaneous tissues. And it is what we do not do and what we do not advocate anybody do is inject fat into the muscle. Do not want to inject fat into that muscle. It's where you inject the gluteus maximus muscle where you can run into problems. So we advocate and we do not inject into that muscle and stay superficial into that superficial tissues. When you do the tummy tuck, you lift up the pubic area as well at the same time. So it's generally just one procedure. If you have a very protuberant pubic area, then it becomes a little bit more challenging to do it. It may need to be staged, but in general, it's just one procedure.
Great. We have Cactus Fit Tamale asking, how close to my goal weight do I need to be for a tummy tuck?
Goal weight, I mean, you know, I advocate that people get to a stable baseline. I mean, a goal weight is just, it's an arbitrary number that somebody makes up. And so be healthy, be normal, have good eating and exercise routines and practices, but be at a stable weight. Now, even if that stable weight is above your goal weight, so to speak, that's okay. Just be at a weight that you think that is manageable for you, is normal for you. Do not go into surgery in huge fluctuations of weight, meaning either going up or going all the way down. So be at a stable plateau weight, regardless of whether or not that is above your goal or below your goal. Sorry.
We have Healthy Gypsy FW asking, is it possible to shape your butt and thighs after severe weight loss without doing a BBL?
Well, yes, I guess is the short answer. Especially, I mean, if you have a significant amount of weight loss, you get a number of different problems that are associated with the weight loss. One of them is you lose a tremendous amount of subcutaneous fat, and that's a good thing. The second thing is that because you lose all of that fat, your skin basically sags. And the majority of the shaping that does occur is usually related to actually lifting and tightening up of that extra tissue. So you have that extra skin that you can lift and tighten in the buttock area and on the outside of the thighs, which actually lifts everything back together again. So yes, you can do it without doing sort of a BBL, by tightening and lifting the skin. And very, very common, very normal, and most people who have a significant amount of weight loss will actually get a pretty significant improvement in their, certainly in their outer thighs and the buttock areas, especially when you do a 360 procedure.
Okay, we have Paca Piranha 11 asking, is it better to lose weight before my tummy tuck because she's been trying to lose it but doesn't lose anything through her stomach area?
Yeah, again, I mean, back to sort of the question about sort of a, you know, a goal weight, ideal weight. I mean, they're gonna be areas on every single person and every single body that are going to be stubborn and resistant to weight loss. And generally those areas, I mean, commonly sort of down low, below the belly button, that's going to be one of those areas. And if you are healthy, eating well and appropriately, maintaining a good diet and exercise regime, and it still stays there, then no, you don't necessarily have to lose that, because certainly we can take that off during a procedure.
Great. Another question from Lil Kitty Millie. Does a lift change the shape of a tuberous breast?
Ooh. So tuberous breast is a very, it's a unique situation that involves a number of different things that you actually have to do. In a tuberous breast, we actually address that by a number of different methods, and it depends upon how significant that tuberous breast is. But in general, most tuberous breasts, you need to lift the breast. Also, you have to sort of release scar tissue on the inside of it, and then generally put in an implant to fill out the tissue. If you simply just lifted a breast that had a tuberous deformity, it's not necessarily going to be the best outcome. So you have to address the skin by lifting, the implant, and then also by releasing the scar tissue on the inside.
Great. Another question from Bridget Brown 1913. When will the office be scheduling surgery?
Good question. I'm gonna close the door. I'm gonna kick the dog out. So it depends. It depends upon the location, obviously, and our California locations, our Oregon and our Washington location. But it is primarily dependent upon the local government. And so we are anticipating, and what we're hoping primarily for the California locations and for our Washington, our Bellevue location, is around May 18th. Our Portland location is actually going to be open May 4th, so starting actually next week. And that's basically because of the governments and the governors in those states to be able to say, in Oregon, you can open up starting May 4th, but Washington and California, we haven't had the go-ahead yet. And so we're hoping it's going to be middle of May, but again, it's really solely dependent upon what the governor tells us and lets us to do.
Great. Another question, for patients who travel to you, how long do you recommend they stay in the Seattle area, and when are they safe to fly, and how would you do follow-up work if there were any post-surgical complications?
So part one, how long do you have to stay in Seattle? It depends upon the surgery. It depends upon the magnitude of the surgery. I generally, usually like people to stick around for 5 to 7 days, depending upon if it's a bigger surgery, just so that we can obviously keep a close eye and close tabs on anything that occurs initially after the surgery. When is it safe to fly? The main thing, to get to that specific question, the main thing is blood clots. We worry about is blood clots. If we are concerned about blood clots, then we'll actually put you on a blood thinner for your flight to alleviate that risk. The only other downside of flying is it hurts sometimes, obviously, and it's annoying to fly. Third part to that question is how do we handle follow-ups? Very easily. Essentially, the quarantine has typified that by basically we do it virtually for the most part. So we do it over the phone, we do virtual consults, we do Zoom things, anything that we can do in order to be able to see that. And if there's any significant issues that come up that we can't handle over the phone, then we can do that in person.
Great. Tiff Taylor sent in that people ask her all the time about financing options.
Yeah, and it's a good question. Yes, financing options, and there's a lot of financing options. And the best thing to do is just basically, when you're discussing any kind of procedure with a consultant, just ask them about the financing issues, and they can certainly go over all of those issues and options with you.
We have Georgia losing it to live with WW. She said that you are the best, and her 360 lower body lift, arm lift, breast lift with implants all were with you, and she is very happy with the results.
Well, thank you, Georgia. You're awesome. We love you. And again, on that note, we're happy to help, but we're one part of the journey. And again, Georgia and people like yourself are just typical examples of that. We can't do what we do without you putting in 99.99% of all of the effort and all of the work that you do. People such as yourself are so motivated, determined to be different, to make a change in your life and the lives of other individuals, that we're there just along, and we're happy to be part and honored to be part of the journey and the thing. But it's you that makes the difference. We're happy to be part of it, though. But Georgia, you're awesome. We love you.
Great. We also have Samantha, Adriana, and Katie writing in that they love their results that they've had with you. We have a question from Cambria Calores. Do you ever treat someone to extra help with skin lifts while they are under for something else?
Sure. As far as I can understand the question, do we do other procedures when you are doing something else? Yes, is the short answer. Yes. The entirety of what we're able to do is dependent upon sort of, in essence, what bothers you. And sort of the people that typify that are obviously the weight loss individuals, where there is a significant amount of skin excess and skin laxity pretty much everywhere on the body. And yes, so we can address multiple different areas at one particular time. But I'm a big advocate of doing as much as possible in one surgery, but safely. And if it's safe to do, then yes, we're happy to do multiple different areas at the same time.
Next question is from Raquel 3R. How to tell if it's better to have lipo or a tummy tuck?
Yeah, and we get this a lot. The essence basically with lipo and a tummy tuck, it relates to the skin. Because when you do liposuction, or any form of liposuction, in order for you to have the best result possible, when you remove the fat, the skin has to shrink. If the skin shrinks, then good, you get a nice contour, you get a nice flat result. If the skin doesn't shrink, it becomes loose and it becomes hanging. So the question becomes, what is the quality of the skin? If there are significant amount of stretch marks there, if there's a lot of extra loose skin, then liposuction or microbody contouring is probably not the best option, because you're going to need to have that skin taken off. If the skin is loose to begin with, then it's best to do a tummy tuck rather than a liposuction. Great.
Next question is asking about recovery for mommy makeover.
Yeah, and it depends, two things. Depends upon what you do in a mommy makeover. And in general, a mommy makeover involves something to do with the abdomen and something to do with the breast usually. And then it depends upon what somebody means by recovery. How long are they going to be in bed? So in general, I will say, though, with all of the magnitude and the different variations of everything, 2 weeks. I'll give you a couple weeks basically for this most significant amount of recovery that will tell you not to do anything, don't lift, push, pull, carry anything heavier than about 10 pounds, and after 2 weeks, slowly start to get back to normal activities. Now that does not mean you will get back to normal activities in 2 weeks. That usually takes around 4 to 6 weeks at least. So plan for 2 weeks to be down and out, and then after that, slowly increase the amount of activity that you can do.
Great. Now our next question is about lipo under the arm. Are you able to do that instead of having a large scar? I'm assuming that is related to lipo versus brachioplasty.
Yeah, and that's the same answer and sort of the same question, the same lines as doing microbody contouring or a tummy tuck on the stomach area. It depends upon the quality of the skin. If you've got good quality skin, good tone to the skin, then you can simply just remove the fat and the skin's going to shrink and it's going to be nice. However, if the skin is loose or there's a significant amount of extra skin, then whenever we remove the fat, the skin's going to hang, and therefore you need to have it taken off. So it's best an assessment of how much skin there is. And again, our consultants are fantastic at that.
Great. Our next question is from Sunshine15. How long should I take off of work for a 360 body lift? She works in the restaurant industry and is on her feet all day.
Yeah, so minimum of 2 weeks. And it depends, again, so, there's lots of different caveats. I would say plan a minimum of 2 weeks. It is theoretically possible you could go back sooner than that, but I would anticipate minimum of 2 weeks. But I would probably estimate, though, push it a little bit longer than that. Again, we would love to say take off a month, but that's generally not realistic for most people. A minimum of 2 weeks, but it could be longer than that.
Great. Our next question is asking if you do surgeries in Fresno.
So, we have fantastic surgeons at all of our locations, all our 3 locations in California and Portland and in Bellevue. So we've got great surgeons at all of those locations. But specifically, yes, I do travel to all of the locations to see patients and to perform procedures, yeah.
Great. Our next question is from Southern Keto Girl. She is looking to have a brachioplasty this year and is wondering if there is ever nerve damage that can happen with this procedure.
Very, very, very unlikely, very uncommon. We can never say in medicine that nothing will ever happen, of course, much like when you get into a car. You can't say you're never going to get into an accident. But because we're just dealing with the skin and the fat that's underneath it and staying away from all of the major nerves and arteries, very, very unlikely, very uncommon.
Great. We have Samantha Farley writing in that she's 7 weeks post-op her mommy makeover and is just finding her groove. We have 07 Jeanette 16. How long is recovery time after an arm lift?
Well, arm lifts, brachioplasties, if you're talking about removing the skin, where we make an incision down here and remove the extra skin from down here, in general, actually, that's a pretty quick recovery. I'll say that arm lifts are a little annoying in the fact that every time you walk, every time you move, it rubs against your body. But in general, the recovery is actually fairly quick. So we'll tell you, again, as with all surgeries, don't do too much for the first 2 weeks. Don't lift, push, pull, carry anything heavy than about 10 pounds for the first 2 weeks, but then slowly start to get back to your normal activity. And arm lifts are one of those ones that actually you can get back fairly quickly.
Great. Next question from Pamela Wyatt, 35. My daughter lost over 100 pounds on Weight Watchers and is 20 years old.
Wow.
Is that an age you would consider, as she hasn't had any children yet?
Yeah, and that certainly is dependent upon her. The age being, for 20 years old and be able to lose 100 pounds, that is an amazing endeavor. To be able to be that young, to be that productive, to be able to lose 100 pounds at that weight. More power to you. That is phenomenal. Yes, at 20 years old, you're going to have the extra skin, especially if you've lost that extra weight. And so you can certainly perform that procedure. And it gets back to one of the original questions is in terms of, childbearing. It's going to be up to her in terms of what she thinks her and what her road and her path is going to be like. If she's not anticipating having any children in the next number of years, then yes, it's absolutely very reasonable.
Great. We have a question from Fat to Fit to Fitastic. Are you able to do a hernia repair while having a tummy tuck?
The short answer, yes. Hernias, especially umbilical hernias or belly button hernias, incredibly common. Whenever we go into the surgeries, we tend to find very frequently a small little hernia in the belly button there. And the short answer, yes. It's very common that we find those, and it's very common that we actually fix those. There are some people that have very big hernias that actually need to be fixed prior to us doing a tummy tuck, but the vast majority of individuals with a small belly button hernia, yes, we're able to fix that at the same time as a tummy tuck.
Great. Our next question is from Lauren Huggs. Saline or silicone with a breast lift? Also, is it true that you need an MRI every 2 years with silicone? And is there an alternate option?
Lots of questions. We could spend a long time on this. So saline and silicone. Saline, that is the basic decision on that is up to the individual. So it's up to you. Certainly there are pros and cons to both saline and to silicone. And I will say that the vast majority of individuals that we put implants in, and indeed the vast majority of individuals in North America receive silicone implants or a silicone-based implant. They tend to feel a little bit better, move a little bit more naturally, and have a little bit less complications. But the ultimate decision is based upon you in terms of what you need to do and what you want to do. Do you need an MRI every 2 years? No, is the short answer. You don't need an MRI every 2 years. The FDA recommended that if you want to determine the status of the implant, whether or not the implant is intact or ruptured, then you would obtain an MRI. But in general, certainly in my experience, most people who have an implant that has a problem, you'll know about it. There's going to be a change in size, a change in the shape to the breast, and then you'll work it up that way. Other options? Not really. I mean, there are, in terms of implants, there are saline implants and silicone-based implants, so sort of a silicone gel or a cohesive gel silicone-based implant, which tends to have more of a less chance of rippling, a less chance of rupture. Individuals who want a little bit smaller of a breast, we can actually put fat into the breast. So we can actually take some of your fat and then put it back into the breast, and that fat that we put back into the breast will then grow in new blood vessels and it'll survive. So if it's not implants, then certainly fat is an alternative option.
Great. Let's see. We have Raquel 3R asking again, what conditions would be not a candidate for tummy tuck, or either a 360 or just the front part? So I'm thinking she is asking kind of tummy tuck versus 360.
So the people who benefit from 360, and again, I mean, 360 means an incision that goes all the way around the body. So you sort of do a tummy tuck in the front, and that incision goes around to the back so that you can take off that extra skin on the sides and then lift up on the buttock and the outside of the thigh as well. So those people who benefit from a 360 are those people who have loose extra skin, primarily on the outside of the thigh, on the buttock area, that would benefit from taking that off and lifting it back up again. Those people who don't have that extra loose skin on the side, then they benefit primarily from just doing a tummy tuck and then microbody contouring around to the back.
Great. Our next question is asking about skin integrity. Are you able to do a tummy tuck on someone who has super deep stretch marks that are very low? Mine are very deep and they break open and bleed. Is skin quality a risk? That's from Britt Lahoff.
Stretch marks, and especially wide, deep stretch marks, incredibly common. And so tummy tucks, actually, that's one of the great things about it, is with a tummy tuck, we remove the vast majority of those stretch marks. So by the very essence of a stretch mark is you rip the undersurface of the skin, and it is super, super thin, and so it can erode away and it can abrade. So no, the fact that you have those stretch marks would indicate that you need a tummy tuck. And so the presence of them doesn't mean that you shouldn't get one at all. The presence of them means that you probably would benefit the most from getting a tummy tuck.
Great. Question from Paopa O. How much should I weigh to do a tummy tuck?
And again, very common question, but it's up to the individual. I mean, it certainly is. And I would say that as a BMI range, you need to have a BMI range that is relatively sort of in the normal range. We generally, for most individuals, to reduce the complication rate, like a BMI in the 30s, somewhere 35, 37 and below. So certainly somebody who has a higher BMI than that, they're not a good candidate for doing any kind of body contouring procedure. But if the BMI is below that, then essentially be as healthy as you can, lose as much weight as you possibly can, but be at a normal sort of plateaued, stable weight, and then have the procedure.
Great. Next question. We've had a few cost things. I know that's typically a per case basis based on what that exact person needs. We've also had cost questions about consults.
Yeah, so cost questions about consults, no. I mean, come in complimentary consults. You'll come in and see one of our fantastic consultants, and certainly if we're available, we'll take a look as well. But no, absolutely come on in, make a consult when we're open and when we get back to doing normal business. Cost per procedure, yes. It is going to be variable depending upon the individual, depending upon the procedure, but certainly our consultants are able to give you that cost analysis right then and there.
She would be traveling from Ireland for her procedure.
Excellent.
And wants to know which surgery center would it take place and how long before she could fly home all the way to Ireland.
So it depends upon certainly, what kind of procedure that you want. I mean,
tummy tuck and breast lift.
Yeah. So, I mean, all of our facilities and all of our surgeons at each one of our facilities is very adept at doing any of these procedures. Best thing to do is basically reach out to us, and then we can sort of steer you in the correct direction. But certainly any one of our facilities would be very easily adept to handle you. In terms of going back, given sort of the length of the travel that you have to go back, if you could, if it's possible, then it would be advisable to stick around for probably 10 to 14 days. And the reason I say 10 to 14 days is the majority of anything that is going to occur in terms of the initial recovery, in terms of the initial discomfort, swelling, drainage, things that may occur are going to occur during that period of time. And obviously we'd want to keep a close eye on you in order to make sure that everything is going according to plan, and then go back after that. And of course, with an 8-hour flight, going back to Ireland, yeah, we'd probably put you on some blood thinners as well going back there. But I'm well aware of that flight. I grew up in England and went to school there for many years, so.
Great. Francine Washburn asks, what causes a person not to have a flat tummy after a tummy tuck?
Yeah, another great question. The most common cause of that is what we call intra-abdominal fat. So when somebody sort of has an abdomen that protrudes a little bit, we always have to try to determine why is it doing that. And it could be protruding for a number of reasons. You know, it could be loose skin, loose muscle, extra fat between the muscle and the skin. But one of the common reasons is fat that is on the inside of the abdomen, around the bowels and around the organs, which we can't take off. The only thing that you can do to get rid of that fat is diet and exercise. So once you've tightened up the skin, taken off the skin, tightened up the muscles, and taken the fat off between the muscle and skin, if it's still sticking out a little bit, the most common cause for that is fat that's on the inside around the bowels and organs.
Great. Next we have Andrea Snyder asking about recovery time for a thigh lift and asking how far down does the scar go onto the inner thigh?
Mm-hmm. So thigh lifts, another good question. So the recovery for thigh lifts, I sort of break out into two different things. There's sort of a discomfort associated with the thigh lifts, and then there's the annoyance factor. The discomfort associated with thigh lifts, it is uncomfortable. It's not quite like a tummy tuck. It's a little bit better, but it is one of the procedures where I classify it as much more annoying, much like the arms, but a little bit more so, just because every time you get up and every time you walk around, basically your thighs can sort of rub together. It becomes annoying. Recovery, though, in the general thing, 2 to 4 weeks. How far the scar goes is dependent upon how much extra skin you have. I would say that, certainly in my experience, it's whether or not a scar goes, halfway down the thigh or it goes a little bit further, really doesn't make a difference in terms of the visibility of the scar, but it can make a difference in terms of the overall result. And you certainly don't want to limit your overall result and get a worse result just to have a slightly smaller scar. So in general, I will say that for the most people, the scar goes probably 3/4 of the way down the thigh towards the upper portion of the knee.
Our next question is from Drea Nicole 24. She is asking about different techniques for tummy tucks and asking about drains versus no drains. Which is better, and is it okay not to use drains?
Yeah, so the short answer is, whether or not you use drains has sort of two factors. There's a patient factor and then a surgeon factor. Not all individuals are candidates for not having a drain, and doing a drainless tummy tuck is a good way to go for some individuals. If you have a lot of liposuction at the same time and microbody contouring at the same time as a tummy tuck, then probably not putting it in a drain is not the best option. But if we're taking out a little bit of skin and you don't have a tremendous amount of fat, then doing a drainless tummy tuck is actually a good way to go if the surgeon is comfortable and confident doing it that way. As to whether or not which one is better, they're both good if the surgeon is comfortable doing it, and all of our surgeons can do it, and if the patient is appropriate for that as well. So that you can achieve a great result doing it either way if the patient is good and the surgeon, as they are at all of our facilities, is comfortable doing it.
Great. Next question. How long after a tummy tuck does wearing a compression garment actually help or do something?
Yeah. Well, we tell people wear it for 4 weeks, and I will tell, and as I tell all my patients, the longer the better. Because the presence and the essence of a garment is to compress the swelling, kind of squeeze the water out of the sponge, squeeze that swelling out of the tissues, and also to encourage the skin to shrink. And I would say that if you can manage it, 3 months is great. If you can tolerate some form of compression, the compression garment that we usually give you, yes, leave that on for about 4 weeks. You could use that same compression or a different type of compression garment for another couple months after that. Or you can go to something like a Spanx, which is going to be comfortable. But at least I recommend 3 months. The longer the better. Wearing it, it's annoying, but it's not going to hurt.
Next question, Samantha Farley wants to know, when can you exercise your ab muscles following a mommy makeover?
When can you and when are you going to want to or do different things? So when you can, in general, after about sort of 3 to 4 weeks. When are you going to want to? A couple months. Because certainly when we tighten up the stomach muscles underneath, we put these big heavy sutures in there, and when you contract your stomach muscles, say working out, doing the ab workouts, it's gonna kind of hurt. So you can, after 3 to 4 weeks, most people won't want to for a few months after that.
Okay. Next question is from Francine Washburn. Can vaser lipo give you a flat tummy?
The lipo can. There are certain adjuncts to liposuction, whether it be ultrasound like vaser or smart lipo like laser lipo or any of these other types of devices. In essence, they are adjuncts or additional measures in order to try and tighten up some of the skin. That particular device, so vaser, laser, anything like that, is not going to be the thing that creates you to have a flat stomach. Removing the fat underneath and then your body and your skin shrinking is going to do it. But that actual, unfortunately, the device in and of itself will not create a flat stomach in everybody.
Okay. Is there a specific diet you recommend following lipo or tummy tuck?
There are countless diets out there. I generally recommend something that is going to be high in protein and low in carbohydrates. Protein is going to be necessary in order to be able to try and heal everything. It also allows you, the more protein you put in your bloodstream, the more fluid it sucks in to the bloodstream to reduce the amount of swelling. So higher in protein, lower in carbohydrates is a good way to go for most surgical diets.
Okay. Next question. Does having a clotting disorder disqualify me for a tummy tuck?
Depends upon the magnitude and the severity of the clotting disorder. So certainly we can discuss that. I mean, we have a number of individuals where we do, things like tummy tucks in somebody with a clotting disorder, but it really depends upon, again, the magnitude and severity, and we would have to sort of be in discussion and consultation with your hematologist or your primary care physician.
Okay. Drea Nicole asks, I'm scheduled for a mini tummy tuck and lipo with BBL in June with Athenix. I'm very excited. How long do you recommend I be off of work? I am an RN and always on my feet.
Again, I mean, I would advocate a minimum of 2 weeks. I mean, if you can, take 2 weeks. Again, even if at the end of 2 weeks, you're not going to be normal. You're not going to be sort of back to doing every single activity that you can do now. But I would advocate a minimum of 2 weeks if you can.
Next question is about virtual consults. They are asking, when they send photos, are you able to give them a price estimate based on photos?
Usually we can, yes. I mean, at this current time, certainly we're able to take all of the information, the best information we possibly can at the current time, which is just photos and then talking to somebody, and then be able to come up with a quote at that time. Yeah. And again, our consultants are great at that, and they've been doing that since our quarantine.
Another question asks about our offices having Spanish capabilities.
Most of our offices do have Spanish-speaking staff members that we do that work there, yes. And if we don't for some time, we can get interpreter services in order to be able to help us out.
Great.
But the vast majority of our offices, yes, have the Spanish capabilities.
Okay. We have Adeline asking if we would be able to do surgery on someone with a moderate to severe anemia.
Depends upon how severe the anemia is. I mean, there's certainly, again, getting back to the safety factor. We have to do, any procedure that we do has to be safe. There are certain procedures that require minimal amount of blood loss, and therefore, our tolerance level for somebody's anemia can be a little bit less, but it really depends upon the severity of that anemia.
Okay. What do you recommend? What would be a case that you would recommend fat transfer for the breast? When would be a time you would recommend that versus an implant?
And that's sort of dependent upon the individual in terms of what the individual wants. For fat grafts to the breast, basically, we're only able to increase the size of a breast by about half a cup size. So if somebody is okay with half a cup size and has a not saggy breast to begin with, then fine. If somebody wants, 2 to 3 cup sizes bigger, then that's going to be an implant. It looks like we have time for a couple more questions.
Okay.
Yeah.
Brachioplasty asks, can you get lipo if you have high blood pressure?
Yes, if your blood pressure is adequately controlled. And again, it gets back to sort of all of these other questions related to health. It depends upon the severity of the high blood pressure and how well controlled it is. Somebody who has extremely and dangerously high blood pressure, no, we can't. We need that to be able to be back under control in order to be able to perform any safe procedure. But having a slightly higher blood pressure is okay if it's under control and if it's within sort of regulation. And
I know we have some more questions, but I will try and just pick a few more. Ada Tan asks about having a 360 tummy tuck, and she has a tattoo on her side. How would her tattoo look after having a 360?
Tattoos, some people who have these tattoos, they become interesting afterwards because we cut them in half and then put them back together again. Again, it depends upon exactly where the tattoo is. I mean, if your tattoo goes all the way up and down your side, then we'll take off some of that tattoo. And again, it's sort of, if we have extra skin there that will take off, some of that tattoo is going to go, and most people just tattoo over top of it or change it in some regard. But if it goes over the entire side, then yes, some of that tattoo will go.
Okay, I'm going to pick just one more question. Cactus Fit Tamale asks, I have another 100 pounds to lose, but I'm down 80 pounds.
Yeah, good for you.
Do I need to be within a certain BMI? I know we kind of talked about BMI a little bit.
BMI generally, I mean, we like the BMI as a general rule to be below 35 if you can. And so if you can get down to below that BMI, then it's going to be good, because of course the higher the BMI, the higher the risk of any surgical procedure. There's no question about it. So we do like it to be down below 35 if possible.
All right.
One more.
Okay. I will look through my list here and pick one out.
And again, we're open for consults. We're open for virtual consults as this goes on right now. As the quarantine continues and until we are able to reopen again, we are certainly open for virtual consults at all of our locations. So please, any other questions, any further questions, please, you can call at any time and get in touch with one of the consultants.
Okay, I will do one more. Here it is. Heavy to Healthy 5. What's the difference in extended tummy tuck and 360?
Extended tummy tuck basically is a tummy tuck that goes a little bit further around to the side, primarily just to sort of to the hip area here, and maybe a little bit around. A 360 goes all the way around, so you are taking off all of that extra skin in the front, on the side, and then on the back there, and lifting up the buttocks. And certainly from a personal experience perspective, anybody, primarily those individuals who have lost a significant amount of weight, you will benefit from a 360 tummy tuck. Even though it is a bigger scar, longer scar, the difference in the recovery is minimal between a 360 tummy tuck and just a standard tummy tuck. But the difference in the outcome is significant. So if you benefit, and you would benefit aesthetically from it, it's preferable certainly to do the 360 tummy tuck.
Okay. So that will conclude our live session. Sorry if we didn't get to all the questions. Maybe we will host another one at some point.
All right. Well, thank you, everybody. Stay healthy, stay safe, and please be in contact with us. Any more questions or anything that comes up, we're always available. Thanks, and have a great rest of the night.